What's up, guys? All right, I'm Dr. Chris Park. Look, today I want to talk about tianeptine addiction and how to treat it. Okay, so tianeptine is a quote-unquote, legal supplement that you can get at the gas station. It's also known as Tiana Reds, or Zazas. The problem with tianeptine is that, or let's just say, the good part of it is that it acts at certain receptors in the brain like a tricyclic antidepressant, which is an old school, very common antidepressant that we've used for years, okay? So it hits those receptors, so it helps people with their depression and anxiety. But it also hits the opiate receptor, the mu-opioid receptor, similar like to morphine. Okay, I'm not gonna say it's the same as morphine, but it hits those receptors, and so it can give an opiate effect. Now, so basically you're combining almost like an antidepressant and an opiate together. Now, in low doses, it seemed like it worked well, okay, and it's been used in other places for years. But as you can tell just from me explaining it, it has a high risk of abuse. And that's exactly what's happened. In high doses, you get a euphoric effect. The medication itself has a very short half-life, which means it kind of gets out of your system quickly. Now, that sounds like it would probably be a good thing. It's out of my system quickly. But what happens is, after you dose, it runs out and you get withdrawal. And so because of that short half-life, you're having to continue to dose, to escalate your dose. And you developed a significant, withdrawal, redosing, dependent, and addiction cycle, okay? And this is brutal for people. Because all of a sudden you've got somebody who is thinking that they're not messing their life up. They're buying something from the gas station, for goodness sakes, and now they are in full-blown addiction, and it can happen very quickly, okay? Now, also, a lot of people who all struggle with opiate addiction, they're kind of supplementing with this here and there and using this, but it is a devastating drug for many people, and I'm starting to see more and more folks coming into the clinic, and that's what they're struggling with. And so that use can lead to other drugs. I mean, we see a lot of times this escalation in use where people start with something like that, and then maybe they start to inject IV drugs, Dilaudid or heroin, fentanyl. You can just kind of see how the pattern continues to repeat and often escalating and snowballing. And there's a high risk of overdose and death, etc. So how do you treat this addiction if somebody is hooked on this medication? Now, there are different ways. I mean, one, if you could go into like an inpatient detox and be detoxed that way, which might be a good option for many people. Or you could do an intensive outpatient counseling session. You could have medications that could that are not addicted, that could block your withdrawal, etc., and work with you through that process. You definitely need to see a doctor to get the help you need, so that they can make sure you're medically stable through any type of detox or withdrawal. Now, a very common method for treatment of tianeptine addiction is using a medication like methadone or buprenorphine. Buprenorphine being a long-acting, it has a long half-life. It's a partial opiate agonist, so it's going to hit those receptors and block the withdrawal, but without giving a euphoric effect, and with basically being able to stabilize your dose in a safe way, so that you can then manage your recovery, okay? And I've always said that the medication itself is not the recovery. The medication just gives you, that kind of extra tool to assist you in what you need to do to recover from your addiction, so that you can get your life back, so that you can work on your relationships and your job and your purpose in life, etc. That is the point of recovery, so that you can have a better life. Anyway, I've been seeing more and more problems with this tianeptine, and I just wanted to make another video to keep it in your brains. Stay away from it, guys. Do not mess with it. All right. Hope y'all have a great day. Peace.